Bone grafting and implant dentistry, building a foundation for success. When it comes to implant dentistry, one of the most crucial aspects of ensuring a successful outcome is the quality and quantity of the patient's jawbone. In cases where the jawbone has deteriorated or is insufficient to support an implant, bone grafting becomes a necessary procedure to build a solid foundation for the implant. What is bone grafting? Bone grafting is a surgical procedure that involves taking bone from one part of the body or from a donor source and placing it in the jaw where the implant will be placed. This additional bone helps to create a stable and secure environment for the implant to fuse with the surrounding bone, ensuring long-term success. Types of bone grafting. There are several different types of bone grafting procedures that can be used in implant dentistry, depending on the specific needs of the patient. The most common types include autografts. This involves taking bone from another part of the patient's body, such as the hip or jaw, and transferring it to the implant site. Allografts. This involves using bone taken from a donor source, such as a bone bank, to graft onto the implant site. Xenografts. This involves using bone taken from an animal source, such as a cow or pig, to graft onto the implant site. Synthetic grafts. This involves using synthetic materials, such as calcium phosphate or hydroxyapatite, to graft onto the implant site. Each type of bone grafting has its own advantages and disadvantages, and the best option for each patient will depend on their specific needs and circumstances. The bone grafting process. The bone grafting process typically involves several steps, including 1. Consultation. The first step in the bone grafting process is to consult with a qualified implant dentist who can determine the extent of bone loss and the best course of action for the patient. 2. Preparing the graft material. Depending on the type of bone grafting being used, the graft material will be prepared either from the patient's own bone or from a donor source. 3. Placing the graft material. The graft material is then placed in the jaw at the site where the implant will be placed, either as a separate procedure or at the same time as the implant surgery. 4. Healing and integration. The patient will need time to heal after the bone grafting procedure, allowing the graft material to integrate with the surrounding bone. This process can take several months, but is crucial for the long-term success of the implant. Benefits of bone grafting. Bone grafting offers several key benefits for patients undergoing implant dentistry, including 1. Improved implant success rates. By providing a stable and secure foundation for the implant, bone grafting can significantly improve the success rates of implants in patients with compromised bone quality. 2. Better aesthetics. Bone grafting can help to restore lost bone volume and improve the overall aesthetics of the smile, creating a more natural and harmonious appearance. 3. Enhanced function. A solid foundation of bone is crucial for the long-term function of dental implants, allowing patients to eat, speak, and smile with confidence. 4. Preservation of bone structure. By adding bone to areas of bone loss, bone grafting helps to preserve the structure of the jaw and prevent further deterioration. Bone grafting plays a vital role in the success of implant dentistry, providing a strong foundation for implants and ensuring long-term stability and function. By understanding the different types of bone grafting procedures, their benefits, and the bone grafting process, patients can make informed decisions about their dental health and achieve optimal outcomes with their dental implants.